You've probably noticed it at some point. Maybe in the mirror, maybe during an intimate moment, or simply when going about your daily routine. The veins on your penis standing out more prominently than they used to, weaving patterns you never paid much attention to before. For many men over 60, this quiet observation triggers a ripple of curiosity, sometimes even concern. What do these veins actually mean? Are they just another quirk of aging? Or could they be signaling something deeper about your circulation and vascular health? It's easy to shrug it off, to chalk it up to just getting older. But what if I told you that these visible changes might be revealing critical clues about the health of one of the most important systems in your body? Today, we're diving into a topic most men don't talk about but should: what your penis veins say about your circulation health, and why paying attention could make a real difference to your overall well-being as you age. Now, you might be wondering why this even matters. After all, veins are veins, right? They're just there, carrying blood, part of the plumbing. But here's the truth. Your vascular system is like a roadmap of your body's inner health. And in men over 60, this roadmap starts showing signs that can be easy to overlook, but important to understand. Your penis, with its dense network of blood vessels, can sometimes act as a window into your broader circulatory health. It can give hints about how well your heart is functioning, how efficiently your blood is flowing, and whether there might be early warning signs of more serious issues like cardiovascular disease or peripheral artery disease. Before we go any further, take a second and think. Have you ever noticed changes in your veins, or wondered if they mean something more? If so, you're not alone. Feel free to drop a comment below and share your thoughts or questions as we go. You might be surprised how many men are quietly thinking the same things, but have never had the chance to talk about it. Over the next few minutes, we're going to explore exactly how the veins in your penis work, what changes in appearance might mean, how these shifts relate to your overall circulation, and perhaps most importantly, what you can do about it. Whether it's understanding why veins seem to bulge more, why some men develop spider-like patterns, or how erectile function links directly to vascular health, we'll break it all down in a way that's clear, relatable, and easy to follow. This is about more than just curiosity. It's about giving you practical knowledge to help you age well, stay healthy, and remain confident in how your body is working. By the end of this video, you'll not only understand more about what's happening down there, but also how that knowledge empowers you to better monitor your heart, arteries, and circulation as a whole. And if you find this kind of straightforward, health-focused conversation valuable, consider hitting the like button and subscribing so you don't miss future videos like this. You can even tap the little bell so you'll know when new topics drop that matter to you. So let's get comfortable and get started, because understanding your body at any age is one of the smartest things you can do. Let's begin by setting the stage with a bit of background: how your veins and blood vessels actually function, and why they matter even more as you get older. To understand what those veins might be telling you, we first need to take a step back and look at how blood vessels, particularly veins, actually work. Your circulatory system is made up of a vast network of arteries, veins, and capillaries, all working together to move blood throughout your body. Arteries carry oxygen-rich blood from your heart out to your tissues, while veins return that blood, now depleted of oxygen, back to the heart to be refreshed and sent out again. It's a continuous loop, and when everything is working smoothly, you hardly notice it. But as we get older, particularly past 60, changes in our blood vessels start to appear. They lose some of their elasticity, they can stiffen, and the valves inside veins, tiny flaps that help keep blood moving in the right direction, can weaken. All of this affects how blood flows, especially in areas where gravity plays a role, like the legs, or yes, the penis. The penis is unique because it relies heavily on healthy, responsive blood vessels for both normal function and sexual performance. It contains not just veins, but also a dense network of arteries and smaller capillaries that work together to control blood flow in a highly coordinated way. When you become aroused, your arteries widen and blood rushes into chambers called the corpora cavernosa. At the same time, veins constrict slightly to trap that blood and maintain an erection. This delicate balance between arterial inflow and venous outflow is why vascular health is so closely tied to erectile function. If the veins or arteries aren't working as well as they used to, it can show up first as changes in appearance or changes in performance, and often long before other symptoms of circulatory problems appear elsewhere in the body. That's why experts often say that erectile dysfunction can be an early warning sign of cardiovascular disease. Studies have shown that men who experience new or worsening erectile problems often have an increased risk of heart issues within the next 3 to 5 years. It all comes back to the fact that the blood vessels in the penis are smaller and more sensitive to changes than the larger arteries leading to the heart. So, while you might not yet notice chest pain or shortness of breath, the vascular shifts affecting erectile function can quietly be pointing to underlying problems that deserve attention. And here's something else that's important to understand. Veins themselves are not just passive tubes. They're lined with smooth muscle and contain those small valves I mentioned earlier. With age, those valves can become less effective at preventing backflow, leading to a pooling of blood that makes veins appear more prominent, twisted, or bulging. You may have heard of varicose veins in the legs. Similar processes can happen elsewhere, including the genital area, though they're less talked about. In the penis, this can show up as veins that are more visible when flaccid, or veins that seem to bulge or twist more than they did when you were younger. It doesn't always mean something is seriously wrong, but it does mean your vascular system is shifting, and paying attention is wise. For men in their 60s and beyond, these natural changes are part of the landscape of aging. But knowing the difference between normal variation and signs of potential concern is where you gain the upper hand. That's exactly what we'll explore next: how to interpret the specific changes you might see and what they could be signaling, both for your sexual health and your overall circulation. So let's move from the foundation to the key insights and start connecting the dots to what those veins might really be trying to tell you. Now that we have a clearer picture of how your veins work and why they change with age, let's talk about what those specific changes might actually be telling you. You might have noticed that the veins on your penis seem more prominent than they were a decade ago. They could appear as thicker, rope-like structures running along the shaft, or as a network of finer, web-like veins that sit just beneath the skin. For many men, these changes are perfectly normal and simply reflect the natural thinning of skin and connective tissue that occurs with age. As the skin loses some of its elasticity and collagen, the veins underneath become easier to see. Combine that with years of normal wear and tear on your vascular system, and it's not surprising that the blueprint of your veins is more visible than it once was. But there's more to the story. When veins become not just visible, but also twisted, bulging, or tender to the touch, that can sometimes signal venous insufficiency, meaning the valves inside the veins aren't doing their job as effectively. This allows blood to pool and creates pressure that can stretch the vein walls. While most men associate varicose veins with legs, the truth is that similar venous conditions can appear in the genital area. One example is something called a penile varicosity, essentially a varicose vein on the penis. Although often harmless and mostly a cosmetic issue, in some cases it can cause discomfort, especially during arousal or intercourse. If a vein feels unusually firm, painful, or inflamed, it could even be a condition known as thrombophlebitis, a small clot in the superficial vein, which, while not life-threatening, does warrant a conversation with your doctor. Another subtle but important clue comes from the link between penile blood vessels and overall endothelial health. The endothelium is the thin lining inside all your blood vessels, playing a crucial role in regulating blood flow and vascular tone. When endothelial function declines, often due to factors like high blood pressure, high cholesterol, diabetes, or smoking history, it can reduce nitric oxide production. Nitric oxide is essential for relaxing blood vessels and allowing blood to flow freely. A decline in this function not only affects erections, but also increases cardiovascular risk. That's why studies repeatedly show that men with erectile difficulties often have higher rates of heart disease. The same endothelial dysfunction is playing out in both places. So if you're seeing changes in how veins behave or noticing a decline in erectile firmness, it might be worth considering a heart checkup, not just chalking it up to age alone. There's also the question of Peyronie's disease, a condition where scar tissue forms inside the penis, causing curvature or lumps. While not directly related to veins, it can sometimes be confused with prominent veins or mistaken for vascular changes. Peyronie's often presents as a firm plaque or bend during erection and is most common in men over 50. It's another example of how vascular and connective tissue health intertwine in this part of the body and why paying close attention matters. And finally, we can't talk about penile veins without touching on lifestyle influences. Long-term habits like smoking, a sedentary lifestyle, or poorly managed blood sugar levels all take a toll on vascular health. They don't just affect your heart or legs. They quietly erode the integrity of blood vessels everywhere, including those delicate ones in the penis. So when veins start to change appearance, it's not just skin deep. It can be a gentle nudge from your body to review your overall circulation and lifestyle habits. By recognizing these patterns, whether it's more visible veins, occasional tenderness, or shifts in erectile quality, you're essentially gathering valuable feedback from your vascular system. And the good news is, understanding this feedback gives you the power to respond proactively. Next, we'll explore exactly how to apply this knowledge to your everyday life. What practical steps you can take to keep those veins and your circulation as a whole functioning at their best as you continue to age with confidence. So now that we've connected the dots, and you have a clearer picture of how the veins in your penis can reflect your broader circulatory health, let's bring it closer to home. Let's talk about what you can actually do with this information starting today. The first thing to know is that being observant, not obsessive, but simply mindful, is a powerful habit as you age. Just as you might keep an eye on your blood pressure or cholesterol numbers, casually noting changes in the appearance or feel of your veins is a form of self-monitoring that can quietly keep you ahead of potential issues. If you notice a vein that looks suddenly more twisted, feels unusually firm, or is accompanied by swelling or discomfort, that's worth a mention to your healthcare provider, not because it's necessarily an emergency, but because it helps complete the picture of your overall vascular health. What's even more important, though, is understanding that your daily habits have a direct line to how healthy those veins stay. Simple actions, when done consistently, can make a profound difference in how well your circulation supports not just your penis, but your entire cardiovascular system. Walking regularly, for example, encourages healthy blood flow and strengthens the muscles around your veins, helping them push blood more effectively. Even 20 to 30 minutes of brisk walking most days can improve endothelial function and boost nitric oxide production, both of which translate to better vascular tone and potentially better erectile function. If walking isn't an option, swimming, cycling, or gentle stretching all provide similar benefits. Diet matters just as much. Foods rich in antioxidants, healthy fats, and fiber, like leafy greens, berries, nuts, and oily fish, help protect your blood vessels from inflammation and oxidative stress, both of which can erode vein and artery health over time. Staying hydrated, limiting processed foods, and reducing excess salt intake can also support healthy blood pressure, which in turn reduces strain on your veins. For many men in their 60s and beyond, small shifts in eating habits, like swapping out processed snacks for fresh fruit or adding a handful of walnuts to a salad, gradually reinforce better circulation with every bite. There's also something to be said for pelvic health. Strengthening the muscles of the pelvic floor through simple exercises known as Kegels can improve blood flow and support erectile function by helping maintain venous tone in that region. While Kegels are often discussed in the context of urinary control, they have clear benefits for sexual health as well, especially when practiced regularly. It's a discreet, simple habit that takes just a few minutes a day, but can enhance both performance and vascular resilience over time. And let's not forget lifestyle choices that quietly wear down vascular health if left unchecked. Smoking, whether current or past, significantly damages the lining of your blood vessels and accelerates venous insufficiency. If you've quit, that's fantastic, and your veins are already thanking you. If you're still working on it, know that every step toward reducing tobacco use lightens the load on your circulation. Managing blood sugar, keeping weight within a healthy range, and monitoring blood pressure all feed into the same cycle: healthier vessels, better blood flow, and more resilient veins. Perhaps the most empowering mindset here is recognizing that the visible veins on your penis are not isolated curiosities. They're part of a system that responds directly to how you move, eat, breathe, and live each day. Even subtle, gradual improvements in lifestyle ripple outward into better endothelial health, smoother circulation, and a lower risk of cardiovascular disease. The veins are just one visible marker of these internal shifts, making them a surprisingly useful tool for gauging how well your efforts are working. As we move toward wrapping up, keep this in mind: your body is remarkably adaptive, even in your 60s and beyond. The steps you take now don't just maintain your health, they actively improve it. The veins you see today can look healthier tomorrow with the right habits. Let's now reflect on everything we've covered and finish with a few key takeaways that tie it all together. As we reflect on everything we've covered, it's clear that something as simple as the veins on your penis can actually offer a window into your overall circulatory health in ways you might not have considered before. We started with the quiet but common observation many men make as they age: veins that seem more prominent, patterns that weren't as noticeable in younger years, textures and shapes that shift subtly over time. We uncovered how these visible veins aren't just cosmetic quirks, but part of a finely tuned vascular system that can, if you pay attention, give you early clues about the state of your arteries, your heart, and your blood flow. From understanding how healthy veins and arteries support not just erections, but full-body circulation, to recognizing that changes like bulging, twisting, or tenderness might deserve a second look, you've now equipped yourself with a layer of awareness that can only work to your benefit as you continue to age. We dug into how factors like venous insufficiency, endothelial health, and even lifestyle choices from decades past can shape the health of your vascular system today. And importantly, we talked about the many practical, manageable steps that can support healthier veins and better circulation going forward. Things like walking regularly, eating nutrient-rich foods, practicing pelvic floor exercises, staying hydrated, and managing key risk factors such as blood pressure, blood sugar, and cholesterol aren't just textbook advice. They're real, proven strategies that directly enhance how your veins and arteries function, including the ones you can see every day. The key takeaway here is simple but powerful. Your body, even at 60 or 70, still responds to positive changes. The veins on your penis aren't just reflecting age, they're reflecting how you live and how well your circulatory system is supported. With steady attention and small, consistent actions, you can influence that system in ways that keep you healthier, more energetic, and more confident in how your body works. If today's video has given you some new insights or perhaps sparked some curiosity about your own health, I encourage you to share your thoughts or experiences in the comments below. Whether it's questions about what's normal, tips you've discovered for supporting vascular health, or simply reflections on what you've noticed as you've aged, Your voice helps build a community where men can talk openly and learn from one another. And if you found this information helpful or enlightening, please consider subscribing to the channel so you won't miss future videos that break down complex health topics in clear, practical ways tailored for your stage of life. Taking charge of your health doesn't always mean drastic overhauls or complex routines. Sometimes it starts with simply paying attention to the signs your body is giving you, even the ones we're taught to ignore or dismiss. The veins you see are part of a living system that's been working hard for you all these years. By understanding and supporting it, you're investing not just in your sexual health, but in your heart, your energy, and your independence as you continue into the decades ahead. Thanks for spending this time learning with me today. Here's to good circulation, good health, and the confidence that comes from knowing your body just a little better. Until next time, take care of yourself. You've earned it.